Just a week had remained before researchers in South Africa were to begin clinical trials of an HIV vaccine, and hopes were high for gaining ground against one of history's deadliest pandemics. Then the email arrived, telling them to halt their research. The United States, under the Trump administration, was withdrawing all its funding.
It was very promising work that we were doing, very basic, and the idea was that if we find a good candidate, that would eventually translate into the rest of the Brilliant Consortium. We would be able to take this through to larger animals and possibly even into human clinical trials.
Their research project, called Brilliant, was meant to be the latest to draw on the region's genetic diversity and deep expertise, which has the highest number of people living with HIV worldwide. In 2024, this region accounted for approximately 65% of all people living with HIV and 86% of children and adolescents living with HIV globally. In South Africa, which received major funding for HIV and AIDS programs, the impact is already being felt. At least 8,000 health workers in South Africa's HIV program have already been laid off, according to the government. And now the future of the HIV research program hangs in the balance.
My position is grant funded. So if there are grants, if the fund is available, the grant is there, then they're able to pay for my salary.
Glenda Gray, who heads the Brilliant program, says the African continent has been vital to the development of HIV medication, and US cuts will be challenging to replace.
Total grant was $46 million, which is about just under R1 billion. And that was divided equally in a period of 6 years. So it was a substantial amount in our first year. We had $7 million, and this was going to be increasing because we were going to make vaccines and do clinical trials. So this is a big gap in our funding. Imagine losing almost R1 billion in 1 month and having to cut back everything and having to scale back all our plans to develop vaccines in the next 2 or 3 years.
The Brilliant program is scrambling to find money to save the project, but South Africa's government said this may be challenging.
At the moment, we are also trying to source funding to be able to continue this work, but again, we do not know whether we will be successful, and that has impact on the research, it has impact on the individuals carrying out the research.
Significant advances have included clinical trials for lenacapavir, the world's only twice-a-year shot to prevent HIV. One study to show its efficacy involved young South Africans, and the shot was recently approved for use by the US Food and Drug Administration. Now, the future of more potential groundbreaking work hangs in the balance as researchers confront more barriers along the way. David Mbidi, CGTN.